Reclaiming rights, rebuilding lives.
Welcome to KTN News Health Watch. I'm Dr. Mercy Korir. It has been 6 months of a global health crisis that has shaken the Kenyan healthcare system. The COVID-19 pandemic found Kenya not prepared to face the pandemic and its healthcare workers not adequately kitted to face the virus. So far, more than 1,000 healthcare workers have contracted the virus and 16 have so far succumbed to this infection. There have been cases of inadequate personal protective equipment and even healthcare workers needing to reuse some of the equipment that should not even be reused. What really has been ailing Kenyan healthcare system in providing protective equipment for its healthcare workers? Our health and science reporter Beldin Waleula takes a look at this.
After cases of coronavirus surged in the country, the demand for personal protective equipment, PPEs, also increased, and unpredictability in demand arose a shortage of supply as there was panic buying and hoarding, putting healthcare workers' lives at risk as they rely on the PPEs to protect themselves and their patients. This has led to numerous strike threats as doctors and nurses decried of the shortage of PPEs.
You have seen that the medics who have been infected in line of duty, they have also infected patients. And so for you to protect Kenyans, you must start with protecting that healthcare worker.
After a few months into the pandemic, Kenya started manufacturing PPEs to curb the shortage being experienced, but complaints arose again of substandard PPEs in the market.
We have observed that some unscrupulous individuals are selling PPEs when delivered to their institutions.
Even after the announcement of PPEs being manufactured locally, the shortage is still being experienced, and even union leaders at some point asking health workers not to attend to COVID-19 patients if they feel not well protected.
No amount of money that will compensate a family for the loss of their loved one.
Cabinet Administrative Secretary Dr. Mercy Mwangangi, in one of the COVID-19 briefings, asked anyone experiencing PPE shortage to walk into the ministry for one.
We've put in place mechanisms and we continue to encourage each and every healthcare worker, should you come across a PPE that you feel is defective in any manner, our doors are always open.
According to Kenya Medical Association President Dr. Were Onyino, PPE shortage is a systematic issue as PPEs are available in the country, but the supply is not trickling down to health workers.
We are seeing an administrative issue now coming into play, where we're finding the PPEs are supplied to our institutions, but they are not reaching the healthcare worker.
As health workers decry of PPE shortage in the country, some were lying idle at the Kenya Medical Supplies Authority KEMSA warehouses after the reverse procurement of COVID-19 PPEs failed to go through, as counties were urged to procure their own protective equipment for the healthcare workers. Now, most of the healthcare workers are depending on PPE donations from private sector and other non-governmental organizations.
Now joining us on this conversation on PPEs when it comes to Kenya's COVID-19 response is the Acting Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, Dr. Chibanzi Mwachonda, who himself contracted the virus. Now, Dr. We've been talking a lot about PPEs. Healthcare workers have been complaining about availability and the quality of PPEs. What really is the problem?
So the first issue of personal protective equipment is that we've not had adequate personal protective equipment Where we've had adequate supply is in the COVID-19 facilities, the designated COVID-19 facilities. But outside those facilities, remember we have level 4 facilities, level 3 facilities, level 2 facilities, and the widespread community transmission. It means every healthcare worker is at risk in the facilities, and that is the first problem that has been there. The second issue that we've had with PPEs is the substandard PPEs in circulation. This is an issue that has not been addressed conclusively, and mainly because we've not seen government come out and declare that the following local manufacturers of PPEs are producing standard, the following are producing substandard, and therefore we urge all county governments and all employers county governments and ministry to procure from these companies that have been regulated and have been assessed to ensure that they produce standard and quality personal protective equipment. So the inadequate and the substandard PPEs, that has been the major issue up until now.
During the training and sensitization of healthcare workers to handle the COVID-19 pandemic, was personal protective equipment and its availability one of the things that was being discussed, or one of the things that was being prepared for healthcare workers?
I think the need for quality personal protective equipment has been there. It's something that has been seen by all. The only challenge we've had is the operationalization of ensuring that it remains something that is streamlined. I think the biggest problem we have in our system so far is streamlining systems to ensure that we offer quality. And with that, of course, the training occurred. We've taken initiatives to train our healthcare workers ourselves, even as representatives of the healthcare workers, to ensure that they're able to detect which ones are quality, which ones are substandard PPEs, and that has really helped a lot. But the training on rational use of PPEs, as late as last month of September, as per the report, the training had only covered up to 25% of all healthcare workers. So that has been a challenge equally.
What's next then, Daktari? Seeing that the COVID-19 pandemic is still here, healthcare workers will still be needed at the front line or the last line of defense, as others may call it. What would you want? What would you, as a union and representative of other healthcare workers, want for the welfare of your healthcare workers?
When it comes to PPEs, the issue is that healthcare workers need a constant supply of quality personal protective equipment. Of course, other issues beyond the PPEs is the issue of compensation that is yet to be rolled out. We know that Cabinet approved the compensation package, but that is yet to be operationalized and effective. It was supposed to be effective July. We've lost healthcare workers, and what we are waiting for right now is that their directive to those who've lost health, those healthcare workers we've lost are able to process now the compensation because they died in the line of duty. Of course, other issues affecting healthcare workers are issues around the incentives that were offered for the first 3 months, but have since been withdrawn. There are no incentives as we speak. The issues, of course, now of general issues that would boost the morale of healthcare workers, things to do with promotions of healthcare workers, timely payment of salaries, and ensuring that healthcare workers do not lack access to the same service they provide through provision of comprehensive medical insurance.
Thank you very much, Daktari, for your insights on PPEs and the issues that healthcare workers had during this particular pandemic, COVID-19 pandemic. Dr. Chibanzi Mwachonda, the Acting Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, on his insights on the issue of PPEs in the country. Now we go to your questions, the ones you've been sending in on COVID-19, and Dr. Githinji Gitahi is here to answer them.
Is testing for COVID-19 still useful?
Testing for COVID-19 is used for different purposes. The first purpose is for surveillance and disease control. That is the one we do to ensure that you identify people who are positive and then you isolate them or ask them to isolate themselves. But the second purpose of testing is for patient care. that you need to know whether somebody is positive so that you know exactly how to do your protocol or management protocol. Now, the first one, and both these have talked about assuming that you're using a confirmatory test, which is what we call the PCR or the real-time PCR. Now, the testing, therefore, is necessary for patient care, and that must continue. The one for isolation is also necessary because you need to continue to identify the people you are able to identify so that you reduce the rate of community transmission, so that you actually isolate them, and therefore also identify and isolate people who may be super spreaders for the disease. So it is still necessary at a confirmatory level.
When should you say it's absolutely necessary to test?
It is absolutely necessary to test, one, somebody with symptoms. You need to decide whether they are COVID or not COVID for care. Secondly, you need to test people who are contacts, and especially those who are contacts and have very high index of suspicion, because then that allows you to isolate. But testing for the purposes of mass testing to know the numbers is not an absolute necessity, because you could then shift, at least for PCR and confirmatory tests. And for that, you could, if you want to study the epidemic curve, then you could then shift your testing from doing antibody tests to doing from doing antigen tests to doing antibody tests, which then just shows you the possibility of exposure for purposes of statistical analysis, but they cannot be used for patient care. It's purely for epidemic surveillance.
Can you differentiate between antibody and antigen PCR testing and when each is necessary?
Two things. If you went into a forest and you're looking for a cheetah, you can look for the cheetah in two ways. You can look for the cheetah by spotting the cheetah, looking for it in the thicket and finding it and confirming and taking a photo of it. Or you can actually look for the footprint of the cheetah, and you can say by finding the footprints of the cheetah, it is likely that the cheetah was here. Now, when you're talking about the first test, which is the confirmatory test, which is what we call the PCR, it is like looking for the cheetah in the thicket. You want to confirm the cheetah is there at that particular point. So you take the samples, largely from the mouth, the nose, and now we are seeing that you can also test saliva or even sputum from the lungs, and you look for the virus presence at that particular point. But and that is necessary for when you're managing a patient, it is necessary for cases where you want to isolate people because they're infectious, because they have the virus at that point.
Why do we see different test results for the same person in different testing laboratories?
The reason for this could be multiple. There are many reasons. One could be how the sample was taken. It starts there. Was the sample taken in a proper manner? Because if you have somebody who is not properly trained taking the sample, if you're required to take a nasal sample, you could actually end up just touching the nose and you don't go deep into the nose. So the training of the person taking is number one. The kit they're using, are they using proper swabs for taking the virus? And finally, how do they transport the virus? They need to have the right medium, which is what we call the virus transport medium, in which to put the virus. So that could be a source of an error. But assuming there is no error there, then the next error could come from the laboratory. The laboratories are using different approaches to identifying the presence of the virus. We use something called the RNA, that's what you're looking for. So they're using different processes of extracting the RNA, different processes of testing. That could also vary. Maybe some are more sensitive than others. So you could be done by one that's not too sensitive, and maybe one depends on a very high concentration of virus, and if the concentration is low, that particular process they use in that lab may not detect that particular virus. So that could be another error.
That's all we had for you on this edition of KTN News Health Watch. Feel free to contact us, give us your questions, your insights, what you think we should cover on any matter on health or on the COVID-19 pandemic. I'm your host, Dr. Mombasa Korir.
Health Watch, brought to you by Kellen. Reclaiming rights, rebuilding lives.